Hi mga ka-CSA, I'm Dr. Mark and I'm back here again at CSA. So I was here 4 weeks ago for my acne scars treatment and some skin resurfacing treatments that we did. We used a new machine, it's called AirShine, and I'm here again for another session of that treatment, and we're also going to do a chin augmentation treatment. So kung nakasubaybay po kayo dun sa mga previous episodes ni Dr. Contessa, we've been treating my acne scars for a while now. We've done a couple of procedures like PDO inch thread insertions, dermal fillers, some fractional lasers, also carbon laser, and I can tell that we've really come a long way. So today, ini-invite ko po kayo to join us again in yet another episode for you to witness another innovation with regard to acne scars and skin resurfacing treatment. Kaya don't forget to click the notification bell, like, and subscribe para updated kayo sa mga bagong videos ni Dr. Contessa here at CSA.
Good day, everyone. Welcome to the CSA Medical Aesthetics. Dr. Contessa here, your certified aesthetic physician. In today's episode, we have a follow-up. Let's all welcome back Dr. Mark Roxas.
Hi Doc. Thank you for having me back.
Yan. So, like few weeks ago, we did the so-called AirShine procedure targeting the marks. Mark? Okay.
Pangalan ko pa.
Okay, so the pimple marks on the forehead, temple, and then the cheek area and the lower cheek region. So how was it, Doc?
It was good, Doc. Actually, yung downtime nga, Doc, siguro mga 1 day lang. A little bit na swelling on the face, but everything was okay.
Yeah.
And ang ganda ng effect, Doc.
Wow, because we had combined also some of the skin nutrients. So there were vitamins, minerals, peptides, amino acids, growth factors that were included in those micro injections. Remember, there were 9 pins for every shot. Okay. So we also had the air dissector where we target the individual marks, the depressed marks. So the air dissection is to instantly elevate those sunken marks. And we just did 1 session, Doc. Okay. Actually, Doc will have a second session today. And then, it's also time for you to improve again the chin area. Okay, so in the past, we have done non-surgical chin augmentation. So we have used our hyaluronic dermal fillers to improve the chin projection, the shape of the chin. So that was like how many years ago? Yeah, before the pandemic, exactly. So for today, we can again do the chin injections and we will add chin threads. That's exciting, Doc. So what is that? So we already have PDO threads that we also use for restoring volume, for skin regeneration, anti-aging, and boosting the collagen in the skin tissues. And a better shape, a better contour, a better look, and of course, always a better Dr. Mark.
So much.
Okay, so we're excited, Doc. We'll show the actual procedure when CSA Medical Aesthetics return. And we are back, so we'll now demonstrate the chin augmentation using our dermal filler. So we have a hyaluronic filler and the goal is to improve the chin length and also the chin projection. Right, Doc? So for our technique, we start with the inferior center point here. So we have to reach for that mentalis region, the deep bone layer. And then we can push a bit of our filler here. So to lengthen it, you can direct your needle towards the symphysis menti region. Right, Doc? So So that's the anatomical plane that we wanted to reach for this one. So we're using again our hyaluronic substances to increase the volume of our chin, augment it, and project it. So a while ago, we did already a checking of the so-called rickets line. So we noticed already, Doc, that there's a lack of projection. So anteriorly, we have to restore that chin projection. So far, so good, Doc?
Yes.
Okay, so after this, okay, we can also inject on the lateral aspects here. Okay, so I can do on the right side first here, and I need to reach the bony region. So the anatomical layer is onto the bone. So pushing that one. So I'm under the muscle, under the mentalis muscle, Doc. It's submuscular. And again, your hyaluronic, it's a good substance for projection and augmentation. And it attracts water. It's a proteoglycan or aminopolysaccharide, Doc. So it's a good humectant. It absorbs water 10,000 times. It's an amazing material or product. It's very natural. It's very safe. So that's the wonderful thing right now, Doc, in our era right now. Oh, in this time, we already have this non-surgical technique. For some people, they combine surgical and non-surgical, okay? But it's a case-to-case basis. We have to still do assessment of those tissues. And of course, safety is very important. So again, I'm onto the bone. So I'm now on the left side of the chin region. Okay, so we'll just push this one. In terms of the number of syringes that you're gonna use, it will vary depending on the need. If we need more volume, you can use more than one syringe. You can use 2, 3, 4 for the chin area. So this is hyaluronic material. Again, it's a natural substance. It's biocompatible. It's tissue friendly. And we really have this hyaluronic inside our tissues in our skin. You're okay, Doc?
Yes, po.
So it's normal to feel some heaviness there or something like, there's something going in, but it's a it's a tolerable procedure. Okay, so I'm just gonna balance it with this side here. So again, I'm restoring the volume and restoring the projection. So immediately after this, we're gonna proceed to the so-called thread volumization. So this is the first time that we're gonna do this for Doc Mark. Right, Doc? Okay. So we have done our chin augmentation using our hyaluronic dermal filler. Let's proceed to our derma threads. So our goal is again to restore also volume and rejuvenation. So we're working on the lower third of the face. And for this part, so let's please disinfect the area. So I'll make a so-called cross-hatching technique. I'll start with the so-called horizontal approach. Okay, so insertion here. So actually our hyaluronic has lidocaine with it. So it's gonna be numb. You're okay, Doc? There you go. And I'll shift to the other side. So my technique is towards the center of the chin. And this is like a contouring type of thread. So we're restoring chin contour also and regenerating the chin and improving the skin texture. So Doc, it's really more of regeneration and rejuvenation. Okay, so I'll pull out these threads. The others are leaving those threads there for hemostasis, which is okay. So we're doing a video demonstration, so we'll just proceed with removing the threads. So there's a technique also whereby we can do a vertical approach here, there, a vertical approach here. So for those people with concerns of skin dimpling in the chin region, right, Doc? So this can improve that too. So this is a 40 millimeter length of our needle here. And actually the thread length is longer. I need more. Okay, you can give me the derma threads. So I've done the horizontal and then half of the vertical. So that is a so-called cross-hatching lift. So this is on the center part. So sometimes our gauge of our needle is smaller. So this is, I think, gauge 29. So that's smaller. So sponge, please. And we have some threads that we call the vertical type of thread. And they vary in their length. Length of the needle, gauge of the needle, length of the thread also. So actually this one is a little bit, because this is gauge 29. So we shifted to gauge 29. A while ago was gauge 27. Okay. So we don't need to really insert the entire length of the needle with this one. We can just make sure that we insert the entire thread, not necessarily the needle. Okay? Now there's another technique that we're gonna do for Doc Mark to improve the jawline, Doc. So we'll be using our PDO threads with gauge 27 and
60.
okay, 60 millimeter length. Okay, so we can do like towards the posterior aspect of your jaw area or towards the mandibular angle. So we just use this gray colored type of needle here, and it's a long one. It's in a 60 millimeter length. Then we can proceed to the opposite side. This is also to improve the so-called marionette line, and at the same time we're improving skin texture, Doc. You're still okay?
Yes, ma'am.
Remember, we did already PDO threads in the past. We had multiple threads, and we worked on improving the acne marks, right? So this is a full lower third treatment. So we have done injections of our PDO threads, so on the chin region, jawline area, and actually I added more of the vertical threads for some of the pitted marks or pitted scars. So let's proceed to the air shine session number 2. And we're now proceeding to the air shine technique or treatment. Okay, there you go. So we have done chin augmentation using dermal filler threads for the chin part as well as the jawline and the mid-face area. And we have done also the air shine procedure, and we'll show the result to Doc Mark when CSA Medical Aesthetics returns. And we're back, so we'll now show the result to Dr. Mark. Doc.
Sino ako, Doc?
Yeah, so we did the chin augmentation using our dermal filler. We also had those PDO threads. So actually, we have a lot of threads that we have done. It's a combination type. We did for the chin, the jawline, and we also included that vertical thread whereby I inserted into the remaining pitted scars that we still have. And then the last part was the air shine treatment. How was it, Doc?
Well, the experience was really good, Doc. Yung pain was very minimal.
Minimal.
And I'm excited for the outcome kasi
Yeah.
alam ko naman na pag ikaw yung gumawa, talaga namang tested and proven and talagang quality talaga, Doc. So, I cannot wait to see the final outcome once
Thank you,
mawala na yung
Doc.
swelling. And again, to those who want to regain their confidence, dun na kayo sa quality talaga. Wag na kayong humanap ng iba pa. Dun tayo sa sure na walang iba kundi sa CSA with Dr. Contessa.
Yes.
Thank you very much, Doc.
Thank you. Okay, so we'll still do like a follow-up, and the air shine treatment, we'll still be doing another session for that one. Usually we do like three sessions of the air shine. And in the past, we've done already like lasers, we've done those threads, we've done those fillers, we've done the carbon laser, today air shine. So it's part of also the skincare maintenance as well as prevention. As they say, prevent and prevent. Okay. So it's better than cure. Okay, so thank you so much, Doc. If you have any questions, you may email us at csaskinclinic@yahoo.com. We have our FB page, CSA Medical Aesthetics, Instagram, CSA Medical Aesthetics. Our clinic is located here at the Infinity Shop, Pulong Maragul, Angeles City. Contact numbers 0933-860-9193 or 0917-504-4268. If you want to see the other episodes that we had with Dr. Mark, just go to our YouTube channel, type Contessa Salvador. Doc, can they reach you on your IG or follow you on your
Yes, sa IG, Doc. Mark
IG?
RNMD for my IG.
Yan, di ba? Yung paano naging
Yung
Dr.
journey,
Mark.
yung
Yes.
journey, Doc. Pero yung
Yeah.
pinaka-interesting, Doc, yung acne scars treatment talaga kasi super chinagamo talaga. Kaya yung mga may trouble sa skin, hindi kayo magsisisi talaga. So go here at wag na kayong mag-delay pa because there's hope.
Yep. And of course, Dr. Mark here kasi masipag sa duty. Sometimes nagkaka-acne pa po. So when there's a new acne, then that new acne is leaving another acne mark. So there's really a maintenance treatment for this one. So thank you. God bless you. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.